If you are preparing for either NEET PG or INI-CET or FMG,
over the past 2 years, there has been a significant inflation in the ranks.
Something extraordinary about Mrinal was his extraordinary rank improvement from securing more than 15,000 rank in NEET PG examination to securing a top 250 rank in INI-CET examination. The biggest issue in most question banks today is... So hi everyone, this is Dr. Aman Telar. If you are preparing for either NEET PG or INI-CET or FMG, this video is very important for you. Today I have with me my batchmate and a very close friend, Dr. Mrinal Devangan. Mrinal is currently doing MD Ophthalmology in AIIMS New Delhi, and something extraordinary about Mrinal was his extraordinary rank improvement from securing more than 15,000 rank in NEET PG examination, which was held in March 2023, to securing a top 250 rank in INI-CET examination, which was just held 2 months later in May 2023. So, Mrinal, what went wrong in NEET PG?
So hello everyone. So let's dive right into it. So I read most of my topics from main notes, but I did not have time to revise them properly. And I also solved a lot of questions from question banks, but explanations used to be so long that I did not have time to revise them. And I also attempted a lot of GTs, but I did not have time to do proper analysis of my mistakes.
Right. So now what did you do next?
So I decided to study from revision notes instead of main notes, and I decided to do 2 to 3 revisions, and I also did analysis of all of my mistakes that I did during my question banks and GTs, and I came up with a list of topics and areas which I was lagging behind, and I decided to strengthen them further and study smarter this time.
So to conclude your strategy, A, you switch to revision notes of the same sources which you had done the main notes.
Yes.
Right? So this was multiple revisions. Second, you analyzed what you did wrong, the questions which you attempted wrong in your question bank, as well as GT, which you were unable to do in your NEET PG preparation. And then based on these mistakes, you made a list of all those topics which you felt you were weak in, and then you read in a smart manner. And that is what is the secret of his rank improvement from 17,000 something rank to securing AIR 229 in just a matter of 2 months. Now, we all three friends, me, Mrinal, and there is another friend, Dr. Anish Agarwal. He is currently doing MS Ortho, and he is himself involved in startups. He has his medtech startup by the name of Neuradec and edtech startup by the name of Medulla Flashcards. So we were discussing this, and we realized that the biggest issue in most question banks today is A, inconsistent explanation lengths. Many of them have too long of explanations which are not revisable, or some of them have too short explanations which are not understandable. The second most important problem is that there are too many random, irrelevant questions which are nowhere close to your PG preparation, won't be asked, will just waste your time, to the extent that just 1 week before NEET PG examination, when I made the video which you can see, a student commented who had generously solved an extensive question bank. He said that, sir, I had bookmarked 6,000 to 7,000 questions, thinking that I would be able to revise them at the end, but I don't think I have the time. So entire almost efforts went into the vain. And exactly the same thing happened with Dr. Mrinal. He studied very hard, but at the end he was unable to revise the mistakes of the questions he had previously attempted.
And also we realize is that most of the resources have 99% the same content. So it pretty much boils down to A, how much are you able to retain, and B, how much are you able to apply that knowledge in exams.
So 2 years ago, we three friends sat down, divided all the 19 subjects amongst us, and we solved a cumulative of 60,000 plus questions, including past 10 years PYQs of NEET PG, INI-CET and FMG. We analyzed patterns and recognized those areas which were repeatedly asked, those areas which were important, those concepts which were important. And then we started to create our own high yield question bank. Now, what has essentially changed in past 2 to 3 years?
So PYQ, essentially everybody knows about them, and they are no longer a secret weapon in such exams. So over the past 2 years, there has been a significant inflation in the ranks.
And so we today are launching a game changer in your PG preparation, be it NEET PG, INICT or FMG, a project we had been working from past 2 years. This is none other but PG Prep Essential High Yield Question Bank and Test Series. We have created a total of 5,000 to 6,000 highest yield questions which are actually doable. This is your question bank which you can actually do and revise your mistakes easily before the exams. Also, there is a test series in which we will be taking one grand test every month. Now, more about this. Why is this test series and question bank different from any other resource? So in question bank, we have just included 250 to 300 highest yield questions per subject. Now, whenever you open a subject, it has been divided into the subtopics, and for each subtopic, there is a time bounded 15 to 25 questions mini test. Now, every question has the explanation which you actually require. Crisp explanation with all the relevant points being bold, and we also used emojis so as to increase the recall. The explanations are consistent throughout the 19 subjects, not big, not small in some subjects. And we have also tried to explain why the other 3 options of almost every question is wrong, so that you get a better understanding of the question. Now, rather than me saying anything, it is better that I show you these questions. Over to you, Mrinal.
So here you can see that we have divided each subject into subtopics, and each subtopic has been presented in the form of 1 to 2 mini tests. Let me show you some of the examples of questions. So here is an example of question from Obs Gynae asking for absolute contraindication for inserting a copper T. So it's a very general knowledge and common sense based question, and the answer is patient unwilling to use IUD. But apart from that, we have also provided other contraindications to IUD insertion in the same explanation, as well as we have provided some clinical insights and NEET PG tips also. And let me show you another example. This is a question from dermatology. It's an image based multiple options correct question. This type of question has been very common in recent INIs and NEET PGs also. So here we have provided a crisp explanation of the question, as well as you can see, we have also provided why all the other 3 options are incorrect, along with some NEET PG tips. Here is another example of a radiology question in which we have provided why all other options are incorrect. And this is an example of a bit higher level application based and image based question from anatomy, asking you to anatomically link the marked area to a brain area. So first you have to know the area which is marked, and then you have to apply your anatomy knowledge to arrive at the correct option.
Right. And we have kept the questions in a test mode so that there is a timer running. Now, why is this important? Because from our experience of attempting questions, if you are attempting a question in a question bank mode, maybe after 10 to 15 questions, we would rather scroll our phone, see notification, maybe watch Instagram. But when we have a timer running in front of us, we have a commitment to complete that test and only then stand up. And there is no crap, simple interface of the app, and every test you can attempt unlimited times. And this testing mode helps you also be in a real exam like mode, and there are no distractions in between. So lastly, we had this motive to keep this project very pocket friendly. So we kept the price for entire 1 year for entire 19 questions question bank along with the test series, just 2,999.
और अगर आप पहले सेलेक्ट हो गए तो ये किसी और जो अपने जूनियर को गिफ्ट कर देना.
Right. And for the first 100 students जो कि enroll कर रहे हैं, for them the price is just ₹1,999. So you can consider checking. The app link is given in the description. You can go ahead and enroll, and you're gonna love it. So whom is this question bank actually meant for? Average student?
Of course.
Topper?
Yes, of course.
NEET PG, INICT or FMG aspirant?
Yes, definitely.
Third or final year MBBS students?
Yeah, why not? Start early and aim higher.
So what I always say is 1 GT a month keeps the FOMO away.
Yeah, I would like to say is that never shy away from taking tests, whatever the level of preparation you have currently, because you will be able to gauge your level of preparation, as well as you will be able to analyze all of the mistakes that you are committing currently.
So we are conducting on first Sunday of every month one grand test which we want you to also give. This is also included in this question bank and test series. So lastly, I would like to say just one thing. Be it NEET PG, INICT or FMG, be it Marrow, PrepLadder, DAMS, Bhatia, eGurukul or Cerebellum. Now, PG Prep Essential app का high yield question bank and test series is the new doable gold standard. So we do not guarantee you a top rank, but what we can guarantee you is a source which utilized properly will guarantee you a top rank. So wish you all the very best. All the important links are given in the description. Please do check out. We hope to see you in your dream branch, in your dream medical college. Take care, love you all, and thank you very much, Dr. Mrinal, and thanks to my friend Anish as well for contributing and for making this project successful. I hope that you all love it. Thank you very much for watching.
Best of luck.
Lastly, if you are an iOS user, you can get the PG Prep Essential app by downloading the My Institute app and putting the org code as XCDS5S. And if you are an Android user, you can directly download the PG Prep Essential app on the Google Play Store right now. Links are in the description. Don't forget to check out. पढ़ाई करो कहीं से भी, लेकिन क्वेश्चन प्रैक्टिस करो यहीं से.